It was a quiet Sunday morning when 52-year-old Alan Thompson felt a slight discomfort in his chest. A committed father, husband, and dedicated software engineer, Alan rarely missed a day of work. Like most, he chalked up the discomfort to indigestion. But within hours, his life was thrust into an emergency that could have cost him everything. This is the story of Alan's journey through a life-altering myocardial infarction, more commonly known as a heart attack, and the fight that followed. Alan had always been generally healthy, though he had a few risk factors. He had a family history of heart disease, was slightly overweight, and had managed high blood pressure for the last 5 years. Like many, Alan found himself overwhelmed by the demands of life and rarely exercised. A bit of stress, he thought, was all part of life. On this particular Sunday, however, as he enjoyed his morning coffee, he felt a strange, heavy sensation across his chest. It wasn't pain exactly, more like someone was pressing down on his chest with a firm hand. It passed quickly, but the discomfort left a nagging feeling in his mind. Throughout the morning, Alan's discomfort became harder to ignore. The heaviness returned intermittently, joined by nausea and a mild, unfamiliar tingling in his left arm. He brushed it off initially. After all, he thought, he wasn't the kind of person who gets sick. But the symptoms intensified. By the early afternoon, Alan was sweating profusely, his skin pale. His wife noticed his discomfort and worried, urged him to go to the emergency room. Reluctantly, Alan agreed. Still, as they drove to the hospital, he could hardly believe that anything serious could be wrong. As soon as he walked through the hospital doors, Alan's symptoms intensified. The emergency room staff, alert to his condition, quickly assessed his vital signs. His blood pressure was through the roof, and his heart rate was erratic. A 12-lead ECG was ordered immediately, revealing the unmistakable signs of a myocardial infarction. Alan was having a STEMI, one of the most dangerous types of heart attacks caused by a complete blockage of a coronary artery. Every second mattered. The emergency team sprang into action, administering oxygen, aspirin, and nitroglycerin to help open the arteries and reduce the heart's workload. But time was slipping away. Alan was wheeled into the catheterization lab within minutes, where the interventional cardiologist was prepared to perform an emergency angioplasty. This life-saving procedure would locate and remove the clot blocking his coronary artery. Under mild sedation, Alan could hear the hum of machines and the quiet voices of the medical team around him. He felt a slight pressure in his groin as the doctor inserted a catheter, threading it up to the coronary arteries, while he was drowsy but conscious. The medical team soon found the culprit. A large blood clot lodged in Alan's left anterior descending artery, sometimes referred to as a widowmaker, due to its critical role in supplying blood to the heart. Using a balloon-tipped catheter, the cardiologist managed to open the blockage and insert a small mesh stent, which would keep the artery open and allow blood to flow again. After what felt like an eternity, Alan's chest pain eased. But the danger wasn't over. The next 24 hours would be critical. Alan was moved to the ICU, where he was closely monitored for any complications like arrhythmias, which often follow a heart attack. His body was weak, and his mind was flooded with questions. How did this happen? Could he have prevented it? His family stood by his side, shaken but grateful that he had survived. As the days passed, Alan began cardiac rehabilitation, a program designed to strengthen his heart and build back his confidence.